I'm Isabel. Today I wanted to talk about things you should think about when deciding whether or not to do a PhD in global health. I finished my PhD in 2020 at Harvard in the Population Health Sciences program under the Department for Global Health and Population. I'm not going to discuss general PhD application tips because I think there's a lot of great advice already out there. Today I really wanted to talk about field-specific things that you should think about when applying to this type of PhD. Most of what I'm talking about, of course, is going to be from my experiences applying for and doing the PhD, though I'd say that much of what I'm going to talk about today is also supported by the experiences of my friends and peers in this program as well as other global health programs. So question number one, do you want to lead research? You can do a lot of things working in global health. You can coordinate child immunization programs, you can train health workers, you can raise funds for certain disease areas like HIV/AIDS or chronic diseases, and you don't need a PhD to hold most positions in global health. In fact, to be involved in research, you don't actually need a PhD either. You can be involved in the coordination, you can be involved in the analytics or general management support of the research study. But if you want to lead research, you do need a PhD. And what does that mean to actually lead research? That means overseeing the entire process from conception to publication. That means you are responsible for the funding, for the data collection, for the study design, for each of these components that go into creating and implementing a research study. Research can make incremental contributions towards changing policies, building programs, and making clinical decisions. And research can be done in many roles in academia, national and international agencies, and NGOs. The opportunities and flexibility is there. Still, you're going to be spending 3 to 5 years doing this degree, so be sure that research is something that you really want to do and something that you enjoy. Question number 2, what are your learning goals for the PhD? Global health is vast in terms of the topic areas that you can focus on, and it's highly multidisciplinary. So to make the most of the time that you have doing a PhD, it makes sense to narrow your focus. Content and context can be learned fairly quickly, so you'll most likely want to focus on some type of methodology to become an expert on. You could focus on epidemiology, economics, statistics and data science, qualitative methods, costing, spatial methods, the list goes on. And this question really ties back to why you want to do the PhD at all. If you can distill down to exactly what it is you want from the PhD, and you identify how the PhD can allow you to do that, you're on the right track. I'd encourage you to write down your learning and expertise goals for the PhD and take some time to strategize how you're going to achieve them using the resources you will have as a student. This will help you avoid getting distracted once the PhD starts, or if you do get distracted, you'll be conscious of this decision to change course. You really don't want to graduate with the sense that you didn't achieve what you came to do in the PhD. Number 3, what kind of research do you want to do? The kind of research that you want to do could have an impact on where you actually choose to do your PhD. Different programs have different reputations for the type of research that they do, and I've found that this largely rings true. For example, when I was applying to various programs at LSHTM, I was basically told that I would be responsible for a research project from start to finish. I would actually design the research study, I would strategize how to do the data collection, and I would actually go collect the data and then analyze it, etc., etc. On the other hand, at Harvard, people kept telling me that you're basically given a data set and you ask research questions based on what's available in the data set. My experience at Harvard was that fewer people actually went out and collected their own data from the very beginning. Often they were added to projects and they asked research questions that they were interested in. In all cases, you were responsible for your own part or corner of a research study that you basically led the whole way through. Answering for yourself what you want to get out of the PhD experience can help you first decide to do the PhD, and second decide where you want to go and who you want to work with and what program might be the best for you. Question number 4, can you handle the politics? Now this goes beyond the PhD a bit, but if you're planning to be in global health for the long haul, politics is worth discussing. It will affect your work, and these are issues upon which you could have an impact for the long term. There's the very formal politics on the international stage, like at the UN and WHO. The cross-cultural politics, so being aware of the cultural differences when you're interacting and communicating with people from other countries, and the office politics. So let's tackle the international stage first. Working in the international arena means going through often lengthy formalities to get things done. There's a lot of red tape and there's a lot of frustration. Remembering what makes it worth it to you to do this work can help in overcoming that, but that's something to keep in mind and be aware of. Handling cross-cultural politics means that you need to be cognizant of how other people will understand and receive your messaging and actions. In many cases, there are unspoken norms that exist. In some cultures, the hierarchy means everything in how you interact at work and how you interact socially. In other contexts, you'll be expected to speak up in every meeting if you have something to say. So are you willing to spend your time carefully crafting your communication in each of these kinds of scenarios? I've lumped the rest of the politics into the term office politics, and perhaps I've been a bit facetious in calling these mere politics. Let me explain. Global health is still largely dominated by older white men, and there's a lot of tensions that arise as a result of this. You may feel that the way things are done or discussed or certain ideas are outdated or just wrong, and you might be correct. Think about how you will deal with these situations. What will be acceptable and what will be unacceptable to you? How will you react? And what will you do to move the space forward in a positive way? It's important to think about, especially at this stage where you're deciding whether you're going to be in global health for the long haul and what role you want to play in this dynamic. I also wanted to mention that despite most of the degree programs and most of the people in the field being largely made up of women, many of the top positions, so directorships, professorships, managerial roles, are still held by men. Men and women may be treated differently in some teams and in some settings. The field does have this imbalance, and that's something to be aware of when you decide which projects to take on, decide which teams to join, or decide where to work. Question number 5, how do you plan on decolonizing global health? This is an important question that I implore you not to run away from. And it's a difficult question. Essentially, global health has its roots in imperialism and colonialism, and a lot of the work is still done in old ways. It's very commonplace to have missions and have people parachuting in for a few days to work on a research project, then leaving. Many academic programs have an applied requirement where you're doing just that. You're coming in for a short period of time to a country as a learning experience for you, but perhaps you're not fully trained to be doing the things that you're asked to do. Think now about how you're going to tackle this as part of the global health space. And really, an underlying goal for a global health program should be to eliminate the need of foreign practitioners. Think about changes you would make to certain projects that you are on. Think about what paradigm shifts you will need to push to make the changes that global health needs to see. Now, my last point is a little bit more practical when thinking about the future. Are you willing to travel extensively for work? Traveling for work may sound glamorous starting out, but once you have a family, well, you want that to be a constant part of your work life. Not to mention, you want to consider all of the neo-colonialism points that we just touched on, and also climate change. Will it be sustainable moving forward? And that's it. That's all I have for you. Let me know if you have any other questions about global health or about the PhD, or any questions in general in the comments. Feel free to hit the subscribe button if you don't want to miss out on future videos. Thanks.